Every one of us, or at least most of us, have had to make a trip to the hospital at least once in our lives. So have you ever wondered how healthcare services might be served in countries around the world compared to your home country? We live in a world with a lot of cultural and political differences. Healthcare is a fundamental human right, and access to quality healthcare services is crucial for individuals and communities to lead a healthy and fulfilling life. However, healthcare systems around the world vary significantly in terms of cost, quality, and accessibility. I have had the privilege of living in various countries, and in this video, I'm going to shed some light on what sort of healthcare is available to people living in the U.S, U.K, Canada, U.A.E and India. Hey friends, my name is Noble, and I'm a medical doctor with an interest in lifestyle medicine. Here on this channel, I discuss various evidence-based natural ways to live a healthier life. I'm also a coach who helps people find their true purpose. Maybe you are unhappy with your work life, going through burnout, feeling stressed, or just wanting to lose weight to feel better. It all ties into getting you back on track to achieve what you really want to achieve in this life. And that's where I come in. Moving on to our video for today. We will now compare and contrast various healthcare systems across the world to understand the advantages and disadvantages of each of them. Please note that this is not based on any specific study, but rather my personal experience while working as a doctor and instances where either myself or someone very close to me has had to make a trip to the hospital. Starting with our first country, India. The Indian healthcare system is a mix of public and private entities, and the country is struggling to provide good quality universal healthcare coverage. When you compare the cost of healthcare in India to countries like the U.S and U.K, it is much less, but for residents in India making a low to moderate income, it is still not affordable. The government has introduced several health insurance schemes for low-income families to increase access to healthcare, but this still does not make up for the sheer amount of population in the country. India's healthcare infrastructure is inadequate, particularly in rural areas, and the country faces a shortage of doctors and medical resources. The quality of healthcare services here can vary significantly, and there is a lack of regulation and accountability in the healthcare industry. You can find cases in rural areas where unqualified laborers or even porters perform small medical procedures on patients, and hospital personnel turn a blind eye due to the shortage of trained medical staff. Oftentimes, these laborers or porters outperform medically qualified doctors. On the opposite side of the spectrum, you have state-of-the-art medical facilities in India with medical professionals conducting cutting-edge research in medicine and technology. You don't need a medical prescription to order tests in many cities, and testing labs have trained phlebotomists who would visit your home, collect samples, and give you test results within 24 to 48 hours by email. Talk about customer service. Another positive feature of India is that it has a strong tradition of alternative medicine such as Ayurveda, homeopathy, and naturopathy, which complement Western medicine and provide a holistic approach to healthcare. India currently spends only about 1.3% of its GDP on healthcare, which is far below the recommended 5 to 6%. So here, increasing government spending on healthcare could help improve healthcare infrastructure and access to healthcare services. Moving on to the next country, the United Arab Emirates, or U.A.E. The United Arab Emirates, as most of you might know, is a very wealthy country with a rapidly growing healthcare sector. Here too, the country's healthcare system is a mix of public and private sectors, and the government is investing heavily in healthcare infrastructure and technology. U.A.E.'s healthcare system is world-class, and the country has state-of-the-art medical facilities. Almost every major international healthcare group has set up their branches and subsidiaries in the U.A.E, such as Cleveland Clinic, King's College Hospital, Mediclinic, etc. It is one of the best places to work as a doctor if you are a seasoned specialist. The government provides free or heavily subsidized healthcare services for its citizens and a limited plan for residents. The facilities are clean, and the practice of any healthcare profession is very strictly regulated with exams and assessments to be eligible to practice. The cost of private healthcare in the U.A.E is very high though, and many residents cannot afford these services if not covered by their employer insurance scheme. Besides minor consultations and small clinic appointments, most residents or expatriates often head back to their home country in Asia to be able to afford expensive procedures and treatments. One major point to note though is that you are almost sure to get an appointment with a general practitioner or even a specialist the same day you make the appointment, and emergency wait times are non-existent. You will get the healthcare you need when you need it in the U.A.E. Our next two countries would be the United Kingdom, which has the National Health Service, and Canada. Both these countries have publicly funded healthcare systems that provide free healthcare services to all residents. The NHS and the Canadian health system are two of the largest employers in the world, and these healthcare systems are funded through taxes. The quality of healthcare services in the U.K and Canada are generally high. They have some of the best medical facilities and technologies in the world. I have worked in the U.K for several years, and the patient-centric approach to treating a condition is something very key here. Unlike a very dictatorial approach of consultation in Asian countries where you are not allowed to even ask a question back to your doctor and you need to just take what is given to you, doctors in the UK and most Western countries take time to explain conditions and treatment protocols a lot better to their patients, because of which they can make an informed decision about their health. Despite all this, these public systems are severely underfunded and there is a shortage of healthcare professionals in most regions. The UK and Canadian healthcare systems are facing significant challenges due to an aging population and increasing demand for healthcare services. The worst part about these systems are their wait times for most services. Unless you book an ambulance to get into the emergency department, you are looking at wait times of 4 to 10 hours to just get seen by your first-line medic in the ER. There are many cases where patients deteriorate while waiting and even lose their lives during that period. I have witnessed a situation myself where a triage staff did not prioritize a 4-year-old boy in the middle of an asthma attack, and even though the little boy's face was turning blue, it took an observant nurse passing by who heard the cry of the mother to identify the situation, and then they quickly admitted the boy. After the pandemic hit, many patients who needed cancer or surgical consultations had to wait more than a year to get an appointment. They would bump you up if you show significant signs of your health deteriorating. So do not expect to get timely healthcare service here unless you go private, and in the UK, Canada and US, costs are way higher than in U.A.E and India. By the way, if you feel like these videos are helping you or someone else, then please consider liking and subscribing to my channel. It would mean a lot to me and it would help me make more content that would serve you better. So moving on to our next country, the United States. Here once again we have a mix of public and private entities, and the US has the highest healthcare expenditure per capita in the world, standing at 16%. The US has some of the best medical facilities and the country is a leader in medical research and development. Private healthcare in the US is generally of high quality and patients have a wide range of options when it comes to choosing healthcare providers. However, despite all these privileges, the US's healthcare system faces significant challenges, including ridiculously high costs, which brings about inequalities in the access to healthcare services. The cost of healthcare in the US is very high and many people cannot afford health insurance or out-of-the-pocket costs. It is a very fragmented system with no universal coverage and many low-income and marginalized communities not being able to afford even the basic of healthcare services. There is a huge aging population which increases the demand for healthcare services, which again increases healthcare costs. So what is it like, or what does it cost for standard medical services in these countries? Let us compare this by taking 3 services as an example: the cost of a general consultation, the cost of a specialist consultation, and the cost of a coronary angioplasty, which is basically when you put a stent inside one or many of the blocked arteries around your heart when you have a heart attack. In India, a general consultation can cost anywhere from $2 to $5 US. A specialist consultation can cost anywhere from $5 to $15 US, and an angioplasty can cost between $2,700 to $5,400 US. In the U.A.E, consultation costs go 10 times more than what you get in India. So a general consultation can cost anywhere from $50 to $70 US. A specialist consultation can cost anywhere from $130 to $160 US, and an angioplasty can cost between $12 to $14,000 US. Canada and UK, having nationalized healthcare, offers free consultations, but if you go private, a general consultation would cost between $100 to $150 US, and a specialist consultation can cost $200 and above. A coronary angioplasty in these countries would cost anywhere from $8,000 to $15,000 US. But as I mentioned, all these costs in almost all cases are covered by the government. Only issue is getting the right care on time for chronic conditions. Coming to the US, and this is where costs start to make no sense. In the US, general consultation starts at $150 US and goes above $400 US for a specialist consultation. If you were to get a coronary angioplasty in the US, you are looking at $30,000 to $40,000 US. If you are not earning enough and don't have the right insurance policy, one such procedure is enough to put you deep in debt or wipe out whatever little savings you have. This is why medical tourism is so popular in many Middle Eastern, South American, and Asian countries. For the cost of having a procedure in the US, you can take an air ticket, stay in a 5-star hotel during your travel, and come back knowing that you had the service offered to a king. I'm trying to make just one point here with all these facts. Healthcare systems around the world are failing. Lack of funding, inadequate infrastructure, shortage of medical staff, poor adoption of technology, and poor quality of care being the reasons. Every country is facing one or more of these issues. In the end, the agenda needs to be clear. Good quality, holistic healthcare for everyone as a basic right when you need it the most. As a human being living in 2023, this is your basic right. So can our governments help us with this, or are we expected to fend for ourselves when we give a decent chunk of our hard-earned money in the form of tax, which just disappears as soon as we pay it? Do you have a solution that can make healthcare more accessible to the common man? Feel free to drop your valuable suggestions in the comment section and we can discuss more about this. But we can also make a difference by preventing diseases linked to bad habits like alcoholism, drug abuse, smoking, an unnecessarily stressful job, or living a very sedentary life. In the next few videos, we are going to be looking at what happens to your body with such unhealthy practices. So stay tuned and stay safe. Until next time, take care and I'll see you around.